Hi, my name is June Minchow. I am the Director of Emergency and Critical Care Services here at Powell Valley Healthcare, and I'm visiting this afternoon with Dr. Kelly Christensen from Powell Valley Clinic. Dr. Christensen, I think that we need to talk about the use of masks in our area. There's been a lot of confusion, and people have varying opinions about how they should wear their masks.
It's the hot topic right now. And before we start, I would just like to give a disclaimer that we're probably going to tick some people off today. People are going to have widely varying opinions on what we say today. People have opinions about the whole COVID-19 thing and how it's been handled from the get-go. And masks are one of the most controversial areas because we lack a lot of data on how well the masks work. And there's so many different kinds of masks. And so what we're going to give you today is our opinion in some cases. And other times we're going to be talking about what is known, and how you interpret that data, it really varies a lot too, just depending on your own personal beliefs and what you want to do and how you feel about the whole thing. It's a very emotional subject. So,
as you can see, sitting right here between us, there are many different kinds of masks, and they vary from those that our community has provided for us, which is great. Thank you, community. Cloth masks. These were made with 3D printers and have special filters in the front of them. So they are more, I guess, masks that would be used in a more critical situation. They're more difficult to breathe through. They're not very fun to wear. These masks were also made by community members, but they're made out of special surgical material, making them almost as effective as a commercially produced product that would be used in our surgery department. These masks, as you can see, are a little bit special because they have a shield that goes over the top of them that protects your eyes, and you don't have to wear glasses with them. These are regular surgical masks, and these are called isolation masks, and these will be the most common ones that you see in the hospital right now, or you may have been handed one as you came into the hospital with a medical problem, or maybe just to go to a lab and get some blood drawn. This one is the one that we would wear only if we were dealing with acute care patients, and it's the one you've heard a lot about on the news. They're called N95 masks. So Dr. Christensen, I would imagine that what most people are asking questions about are the cloth masks. What do you think about wearing cloth masks as you go out into the community?
yeah, that's the question now. Is it should I wear a mask when I go out there? That is a very complicated issue. There's so many issues because masks aren't great. They're not as effective as we would like them to be, and they don't protect you from getting the virus. They only protect you from giving the virus. As far as protecting you from getting it, maybe 4% is the number that it will decrease your chance of getting the virus. And as far as decreasing your risk of spreading the virus, those numbers vary depending on the mask and who made it and how thick it is. And the thicker it is, the better it works, and the more horrible it is to wear. And they're uncomfortable. They're nasty. But if you've been home and you've been quarantining and you're doing the things that you're supposed to be doing, and you're going to run to the supermarket quick and pick up your groceries, but you've been home and quarantining, and your risk of having COVID yourself right now is pushing 0 because you live in Park County and you've been home for 2 weeks and you haven't left and you haven't had people over, then the reason to wear a mask is so you don't spread it to others, but your risk of having it to spread already at that point has got to be pushing 0. So the utility of wearing a mask at that point, there's almost not any utility. And I know people are going to send me hate mail about that, but it's true.
I don't think hate mail, hate mail.
People send angry emails and angry responses and whatever, and I'm sure we're going to get some on this, but that's my opinion. So your opinion may vary. On the other hand, the people that would be more likely to benefit from wearing these, or to get some benefit for other people from wearing a cloth mask, is the people who haven't done as good of a job of quarantining. People who have had some exposures and they know, somebody coughed and they thought, oh no, I hope I didn't get it. If you have some of those risks, then maybe you are the person who should wear a mask when you go out, because you're more likely to be an asymptomatic carrier or a pre-symptomatic carrier, and maybe you are going to spread it. But those people that are in that situation are less likely to be willing to wear one in the first place, probably.
When we check the CDC guidelines, they also indicate that it's only a recommendation that masks be worn if you're going to be in a situation like at the grocery store where you might not be able to distance yourself by that 6-foot limit from someone else.
Yeah.
Would you agree?
Yeah.
Okay.
Here at the hospital, which is where we're at right now, we're not wearing masks because we've both been screened. And what that means is that we don't have a fever today. We haven't been exposed to anybody with known disease. We haven't traveled. We don't have a cough. We don't have shortness of breath. We don't have any of the symptoms that we know. So could we be pre-symptomatic right now? Yeah, but I think that risk is still very, very low.
You know, we want everyone to know that outside of just all of the masks that you may see people wearing, we here at Powell Valley Healthcare have done a phenomenal job in trying to safeguard your health to begin with. When you come to the door, you're screened by trained screeners that ask stock questions. Everybody gets the same questions asked. Your temperature will be taken, no matter whether you're an employee or you're coming in for testing. You may be in a situation where you see a lot of housekeepers around. That's because we're doing extra jobs in getting our housekeeping done and making sure that surfaces are well disinfected. We make sure that if an employee comes in and they are the least bit symptomatic, maybe they have a little bit of a cough or a slight fever, they are immediately sent home and not allowed to work. So we really are protecting your health, whether we're wearing a mask or not. We've taken all those steps, and I would almost think that we're probably safer than when you go to the grocery store or the gas station.
Yeah, for sure. We're at least screening people at the door.
So we do have some people in our facility that are required to wear masks, and those people are the ones who work in our long-term care, Heartland, or work predominantly with our elderly population, because they are definitely at the highest risk from this virus. And so you will almost always see, in fact, I would say you will always see the employees at long-term care or the Heartland wearing masks. They may be homemade masks like these, because really we're protecting our residents. Remember, as Dr. Christensen said, we're protecting you when we wear the mask like this. Or they may just have an isolation mask on like this one that is commercially prepared. Okay.
And the reason we're doing that in the care center and at the Heartland is because the CMS, the Center for Medicare and Medicaid Services, has mandated that. We have to be doing that. So that's why we've made that decision. We've talked about making people wear it in the hospital, and for reasons that we've already talked about, we're not doing that in the hospital at this point. But it's mandated in the care center in the Heartland, so that's what we're doing there.
We still have to be very careful about the amount of masks that we are able to purchase. These masks that are more, the ones that are commercially prepared and the ones that are surgical or the ones that are used in high-risk areas are pretty hard to come by right now. They're difficult to order, and when we can find them, it's taking a long time for them to get here. So we want to safeguard them as much as we can. That's why you'll see people in the care center wearing cloth masks rather than to see them wearing too many commercially prepared masks.
I got two other things about the mask wearing deal. When you do wear a mask like this, they are uncomfortable, and what you see people doing a lot then is readjusting, touching them, moving them, touching their face outside the edges of the mask. And when you're doing that, if you're at the grocery store and you're picking things up off the shelves that other people have been touching too, or the door handle in the bathroom or wherever you've been, you're going to be potentially getting contaminated material not just on your mask, but also on your cheeks and on your face and on your ear and whatever. And then the other thing you're going to be doing, because we do, is you're going to be picking your cell phone up out of your pocket. And how many times a day, you may be washing or sanitizing multiple times a day, how often are you washing your phone? And I guarantee you're touching other stuff and then you're touching your phone. I'd be curious to know how many phones are covered with COVID. Probably one of the best places to transmit it from. So when you take that mask off, if you think, if you've been touching your face more, you might want to wash your face too, wash your hands, wash your phone, all of that stuff.
So just to run through a few safety things about the use of masks. If you choose to wear them and you're wearing a mask that you made at home, or whether you've gotten one of these as you've come through the hospital, there are some things that you should know. They shouldn't be dangled from your ear when you're not using them across your face or hung on a string around your neck. They should be, the outside of your mask, which is where any germs would gather, should be folded to the inside when it's taken off so that you're not scattering that wherever it goes. If it's a cloth mask, it should be regularly washed. You should not wear it more than a day at a time before it's washed in hot soapy water and dried, and then you can put it back on the next day. These masks are generally single-use masks, and so you would wear them once with the, this one I believe is the white side out. Once this part of the mask becomes dirty, if it becomes wet, if it becomes discolored, you're going to throw that away. You don't want to touch it with your fingers. You just want to discard it into a garbage can and dispose of it. Doesn't need to have a red bag or a hazard bag. Just throw it away. Again, wash your hands over and over and over again. Try not to touch the outside of your face, like Dr. Christensen said, and that's a tough thing not to do. We always are playing with our hair or scratching our nose or doing any of those things, talking on our cell phones, and that certainly exposes us to whatever germs we have on our hands. That's a tough thing to do. Anything else that we need to have people be careful about?
I think we've covered every possible mask issue that could arise. Not.
There's always going to be questions out there, and I guess what we want you to know is that things change dramatically. We get updates from the CDC or from our state health office hourly almost. But I guess what the last thing that I personally would want to leave with you is that just because you're wearing a mask, that doesn't make you 10 feet tall and bulletproof. There is still a possibility that you can be exposed to this virus or any virus. It's just as important, maybe more so, to wash your hands, to avoid those places where more than 10 people gather, to be diligent about that 10 or that 6 foot rule. So we have a rule that says you shouldn't be within 6 feet of each other if you want to be safe. All of those things that we've heard on television and radio and that we've talked about are just as important or more so than you wearing a mask to stay safe.